Hello everybody, this is Dr.Gita Mathai and this is my Health Vibes channel. Today we are going to talk about chest pain and why all chest pain is not a heart attack. Sometimes when you're sitting alone or with friends, you suddenly get a pain in your chest, your heart feels like it's going to stop, you may get palpitations and you feel like you're going to die. Oh God, I'm having a heart attack, this is the end of me. Please don't be afraid. 15% of the people do not have heart attacks like this. It is gastroesophageal reflux disease or GERD, a condition where acid contents of the stomach come back into the mouth, burning the stomach, the chest and the esophagus along the way. Why do people get GERD? People get GERD because they have put on weight and the anatomy of the food pipe joining the stomach is distorted. There is actually a valve over there and the valve prevents the food contents from regurgitating back into the mouth. But if you put on a lot of weight, your stomach makes this valve loose and floppy. Second is pregnant women. They cannot really do anything about their large belly for the next 10 months. The third is people who smoke. The nicotine in the cigarettes or in chewing tobacco affects the valve and makes it faulty. Alcohol has a similar action. The other problem is people who eat a large meal and then decide to lie down immediately and go to sleep. Or people who wear very tight clothes which press against the stomach and push the contents upwards. What are the symptoms of GERD? They are not always chest pain. It can be a cough which is worse at night but produces no sputum at all. It can be bad breath. Every time you open your mouth to speak, a foul odor comes out. It can be a sour taste in your mouth all the time so that you feel disgusted with yourself. Or sometimes you may actually feel that the food is coming back after you eat. What happens is that people do not know which physician to consult, so they may go to a dentist and say I have bad breath. They may go to an ENT surgeon and say I have a cough which doesn't go away. They may go to a cardiologist and insist they're having a heart attack. Or they may just decide to take some native medicines for this. But GERD needs to be investigated. You need a chest x-ray, you need an ECG, and you need acid studies to see how much of acid there is in your stomach and if there is really a reflux of this. Once you have been diagnosed with GERD, it is not difficult to treat. You can take omeprazole, ranitidine or antacids. These will cure the symptoms, but just because you get immediate relief, please don't continue to treat yourself because you might get side effects from these medications and it just might be a different diagnosis which is being missed. There are several lifestyle changes that can be made in order to relieve the symptoms of GERD. First of all, lose weight and try to reach your ideal body weight. Second, do not lie down immediately after eating. Wait for an hour, either sit or walk around. Drink 4 liters of water to reduce the acid contents of the stomach. Do not wear tight clothes. Do not smoke and do not drink. If you walk for 40 minutes a day, your stomach muscles will get toned and the chances of GERD are less. This is Dr. Gita Mathai. This is my Health Vibes channel. If you liked what you heard and got any useful tips from it, please subscribe to my Health Vibes channel. The same content is available in Tamil. Thank you.